Medications can be lifesavers, but many of us tend to forget that many of the medications we use have the tendency to silently kill us by affecting our vital organs like liver or kidneys. And this has been proven over and over. In this video, we'll explore 8 popular medications that have been shown to damage the kidneys, helping you make informed decisions about your health. Stay tuned, and let's get started. 1. Blood pressure medications. ACE inhibitors, or angiotensin-converting enzyme inhibitors, and ARBs, or angiotensin II receptor blockers, are 2 classes of medications commonly prescribed for conditions related to the cardiovascular system. Understanding how these medications work and how they can potentially harm the kidneys can help you use them safely. ACE inhibitors work by blocking the action of the angiotensin-converting enzyme, which is involved in the production of angiotensin II, a substance that narrows blood vessels and raises blood pressure. Examples of ACE inhibitors include enalapril, lisinopril, and ramipril. On the other hand, ARBs work by blocking the action of angiotensin II directly at the receptor sites in the body's tissues, preventing its effects and resulting in blood vessel relaxation and lowered blood pressure. Common examples of ARBs include losartan, valsartan, and irbesartan. These medications are often prescribed to treat conditions such as hypertension, heart failure, and diabetic kidney disease, and are chosen by healthcare providers based on individual patient characteristics and medical history. The National Kidney Foundation stated that ACE inhibitors and ARBs are not likely to cause acute kidney injury. But when combined with other factors, the risk of acute kidney injury goes up. These factors include taking non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, naproxen, aspirin, and the likes, taking diuretics also known as water pills like bumetanide, torsemide, and dehydration, which is defined as not drinking enough water to meet your body's need. Please like and hit that subscribe button if you're getting value out of this. 2. Psychiatric medications. When we talk about psychiatric medications, like antidepressants or mood stabilizers, they can sometimes affect our kidneys. Take Prozac, for example, a common antidepressant. It might seem like it only works on our brain, but it can actually put some stress on our kidneys too. Then there's lithium and Elavil. Lithium is a mood-stabilizing medication primarily used to treat bipolar disorder. It helps to reduce the severity and frequency of manic episodes. Elavil is a brand name for the medication amitriptyline, which is a tricyclic antidepressant. It's primarily used to treat depression, but can also be used off-label for conditions like neuropathic pain, fibromyalgia, and certain anxiety disorders. Now, let's get into why these drugs can cause kidney issues. One big reason is that they can lead to muscle breakdown. When muscles break down, they release something called myoglobin into our bloodstream. Myoglobin is like a troublemaker for our kidneys because they have to work extra hard to filter it out. BuzzRx reported that some antidepressants, like fluoxetine, Prozac, amitriptyline, Elavil, and doxepin, zonulin, can cause rhabdomyolysis, a condition that can lead to sudden kidney injury. Additionally, lithium can also cause rhabdomyolysis and lead to long-term kidney problems such as chronic interstitial nephritis and glomerulonephritis. So when taking lithium, it's crucial to find the right dosage and get annual blood tests to check creatinine levels. If you notice any problems, seek medical help immediately. Lithium can cause various health issues, not just kidney damage. Before starting lithium, inform your doctor if you have any kidney, heart, thyroid, or breathing problems, as well as Addison's disease or Brugada syndrome. 3. Proton pump inhibitors. Proton pump inhibitors, PPI, are popular medications for reducing stomach acid, helping with conditions like acid reflux. They work by blocking an enzyme called the proton pump. While effective, PPIs can pose risks to your kidneys. One risk is acute interstitial nephritis, AIN, where parts of the kidney become inflamed. Although rare, PPIs are a common cause of this condition. AIN often has no symptoms, so it can go unnoticed and cause sudden kidney injury, potentially leading to chronic kidney disease over time. Additionally, long-term PPI use can lead to low magnesium levels, hypomagnesemia, which can upset your body's electrolyte balance and cause kidney problems. In short, while PPIs help with acid issues, they can sometimes harm your kidneys, especially with long-term use. A 2019 study in the Journal of Pharmacotherapy looked at how proton pump inhibitors affect kidney health. It found that people using PPIs had a 4.35 times higher risk of acute kidney injury. This is why it's crucial to use PPIs for the shortest duration necessary. If you need to take them long-term, regular checkups to monitor kidney function and magnesium levels are essential. Although acid reflux can be extremely uncomfortable, the relief provided by PPIs is not worth risking your kidney health. Wouldn't you agree? 4. Non-steroidal anti-inflammatory drugs. In all likelihoods, you know what non-steroidal anti-inflammatory drugs are. If by miracle you don't, think diclofenac, ibuprofen, aspirin, Motrin, and the likes. NSAIDs, commonly used for pain relief from headaches, injuries, and arthritis, work by blocking an enzyme called COX. While this helps reduce pain, COX also protects the kidneys. Blocking COX can harm the kidneys by reducing blood flow, which can cause fluid retention, high blood pressure, and temporary kidney problems. In severe cases, this can lead to acute kidney injury and possibly chronic kidney disease. Additionally, despite the fact that NSAIDs are anti-inflammatory, long-term NSAID use can cause inflammation in the kidneys, affecting their ability to filter waste. What is even more troubling is that kidney issues from NSAIDs are relatively common, roughly affecting 500,000 to 2.5 million people every year. According to the National Kidney Foundation, using NSAIDs can lead to sudden kidney damage, a gradual decrease in kidney function in people with chronic kidney disease, imbalances in electrolytes, and increased fluid retention, with worsening heart failure and high blood pressure. 5. Antibiotics. According to the Kidney International reports, drug-induced nephrotoxicity accounts for up to 60% of cases of acute kidney injury in hospitalized patients and is associated with increased morbidity and mortality in both adults and children. They added that antibiotics are one of the most common causes of drug-induced nephrotoxicity. Antibiotics, also known as antibacterials or antimicrobials, are medicines used to treat bacterial infections. They work by either killing the bacteria or stopping them from multiplying. Some common antibiotics include Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin, which can treat infections like strep throat, pneumonia, UTIs, and skin infections. However, antibiotics can't treat viral infections such as colds, flu, or most sore throats. So, it's important to use them only when necessary to avoid side effects. These side effects can include diarrhea and liver and kidney problems. Even when used correctly, some antibiotics can harm your kidneys. For example, polymyxins and aminoglycosides can cause kidney damage. The kidneys help remove antibiotics from your body, but certain antibiotics can damage kidney cells. Polymyxins can harm the cell membranes in your kidneys, leading to injury. Aminoglycosides can accumulate in kidney cells, causing them to die and damaging the kidney tubules. Although the exact ways antibiotics cause kidney injury are not fully understood, it often involves inflammation and damage to kidney cells. This is why before requesting or using an antibiotic, it's important to know which conditions it treats. Ask your doctor, is this necessary? And they may explain if it is. If prescribed, follow the dosage and food instructions precisely. Don't save antibiotics for future use or share them with others, as they are tailored to individual health needs. 6. Diuretics. Diuretics are medications that help reduce fluid buildup, commonly seen in heart failure, kidney failure, and liver cirrhosis. Some are available over the counter, but stronger ones need a prescription. Common diuretics include hydrochlorothiazide, bumetanide, furosemide, spironolactone, and acetazolamide. They work by increasing urine output to remove excess salt and water, helping lower high blood pressure and benefiting kidney health. However, diuretics can pose risks if misused. They don't directly harm the kidneys, but change urine concentration and composition. Overuse or high doses can cause dehydration, which may damage the kidneys. A study examined 131 patients who used diuretics and experienced acute kidney injury between 1999 and 2010 at a hospital. Initially, 96.2% of these patients already had at least one health problem before starting diuretics, with chronic kidney disease being the most common at 55%. The study found that patients using diuretics had higher rates of kidney disease and risk factors such as high blood pressure and diabetes. The higher the dose of diuretics, the greater the risk. Additionally, About 27.5% of the acute kidney injury cases were caused by diuretics alone, while the rest were due to a combination of diuretics and other drugs. With this, you can understand why it's very important to always check with your healthcare provider before taking any diuretic. And if you already suffer from CKD, make sure to stay hydrated and get routine checkups for electrolytes and kidney function. 7. Statins. A study titled, Statins Use and the Risk of Kidney Disease with Long-Term Follow-Up concluded that the use of statins is linked to an increased incidence of acute and chronic kidney disease. According to the medical news today, using statins raises the risk of kidney damage, potentially worsening the health of individuals with kidney failure. They added that this medication can increase the likelihood of conditions like rhabdomyolysis, which can lead to kidney damage, disability, and even death. Statins, such as atorvastatin and simvastatin, are drugs that lower blood cholesterol by inhibiting the enzyme HMG-CoA reductase. They help prevent heart attacks and strokes. However, they can increase the risk of kidney damage by causing rhabdomyolysis, a condition where muscle breakdown releases myoglobin, which is toxic to the kidneys. Statins can also directly decrease kidney function, especially in those with pre-existing kidney conditions, and may interact with other medications, further raising the risk of kidney issues. 8. Supplements. Some supplements can harm the kidneys if not used carefully. For instance, high doses of vitamin C can lead to kidney stones, and too much vitamin D can cause high calcium levels, leading to kidney damage. Herbal supplements like those containing aristolactic acid can directly damage kidney cells. Additionally, protein supplements taken in excess can strain the kidneys, especially in people with pre-existing kidney conditions. If you have kidney disease, it is advisable to avoid supplements containing certain substances. These include chromium picolinate, creatine monohydrate, germanium, L-lysine, Laria tridentata, Posinistalia yohimbi, Salix daphnoids, thunder godvine, cat's claw, ephedra, cranberry, and licorice. Additionally, most herbal supplements marketed for kidney support should be avoided, as they can potentially exacerbate the condition and harm your kidneys. Remember to always consult a healthcare provider before taking supplements, especially if you have kidney issues. If you think your medication is harming your kidneys, see a doctor right away. Early symptoms can be subtle, but worsening conditions include reduced urine, leg swelling, shortness of breath, and severe fatigue. Untreated, these can be life-threatening. To monitor kidney health, especially with certain medications, regularly check blood creatinine levels, GFR, and urine protein. Stay hydrated to help your kidneys flush out toxins. Inform your healthcare provider about all your medications to avoid harmful interactions. Some drugs, like antibiotics, NSAID, diuretics, proton pump inhibitors, ACE inhibitors, psychiatric medications, statins, and some supplements, can damage the kidneys, particularly in those with kidney disease. Work with your doctor to manage these medications carefully and monitor kidney function. A healthy lifestyle with a balanced diet and regular exercise can help minimize your need for medications and protect your kidneys. If you're committed to mastering your kidney health and learning how to care for your delicate organs, be sure to subscribe, hit the bell icon, and turn on all notifications so you never miss a life-saving video. If you found this video helpful, check out the video on the screen where we discuss 6 common supplements that can damage the liver. See you there. Stay informed, stay healthy.